Hello and welcome to this next video. My name's Christopher Hole from ChristopherHole.com. In today's video we're going to be talking about the hip and its relation to its posture and back pain and sort of the different postures as well. So first of all I just want to talk about the neutral posture, which is kind of the posture that we're looking for. So where are we? So what we're looking for during standing in an upright position, an oblique plane through the PSIS, which is the posterior superior iliac spine, so it's like the knobbly bit on the back of your pelvis, of the ilia and the symphysis pubis form an angle about 60 degrees relative to the horizontal plane. Now don't worry too much about that, because what we want to look for is, to keep it simple, this is the neutral position of the pelvis and roughly corresponds to the position in which both the ASIS, which is the anterior superior iliac spine, which is this lumpy knobbly bit on the front, so we've got a knobbly bit on the front, knobbly bit on the back, and we want, so roughly corresponds to the position in which both the ASIS and the pubic symphysis are in the same frontal plane as seen in figure 4.15a, and that corresponds to this one. So the ASIS, which is this knobbly bit at the front, is level or vertically level with this knobbly bit down at the bottom here. So that's sort of the position we're looking for. That's your neutral position. When we get the anterior superior iliac spine here in front of it, that's when we get what's called an anterior pelvic tilt. And then obviously the reverse of that is a posterior pelvic tilt. So here, that's where we might get something like a flat back. And the anterior pelvic tilt is lordosis. So if you want to know a little bit more about lordosis, it's the pelvis tilted forward in an anterior pelvic tilt. So the ASIS is in front of this pubic symphysis. Okay. Then we've also got different other postures. So this, we can get sort of leg length discrepancies, and we got a right lateral tilt and a left lateral tilt. And obviously there's your neutral one. Now looking from the back, you can see here it goes across the top of the pelvis. Now the top of the pelvis is called the iliac crest. So it would be up here, although it's saying the iliac crest is here. What we want to be looking for is this top bit up here. So that's your neutral position. Obviously a left tilt is when the left tilt is higher than the right side. So we might have a right leg slightly longer than a left leg. And then we've got a right lateral tilt, which is the right side slightly higher than the left side, where we might have a right leg which is slightly shorter than our left. Okay, so I just wanted to explain that, so hopefully that sheds a little bit more light on, if you have got maybe a leg length discrepancy or a lordotic posture, or an excessive lordotic posture I should say, maybe it might shed some light on what you need to do. Obviously it's not the whole story because there is a lot more going on, but that's how the hip could play a part in it. Okay, so thanks for watching. My name's Christopher Hole from ChristopherHole.com. I will speak to you in the next video.